Today we are going to learn about macrolides. They are a group of antibiotics that come under antimicrobials. These are bacteriostatic in nature, which means that they only suspend the growth of the bacteria. In this video series, we are going to talk about antibiotics under 6 different headings, that is mechanism of action, spectrum or susceptible organisms, resistance, that is organisms which are resistant to the drug or the mechanism by which they acquire resistance, pharmacokinetics of the drug, examples, and lastly their uses and adverse effects. Before we begin, I would like to tell you that we have divided macrolides under 2 videos. This video will have all the general features of macrolides along with the first generation macrolide erythromycin. The next video will cover the second and third generation macrolides. With this, let us start with the mechanism of action. Macrolides inhibit bacterial protein synthesis by inhibiting the translocation of protein. That is, macrolides bind to the 50S subunit of ribosomes, and when the ribosome moves along the mRNA strand in the process of translation, it is that step that is inhibited by macrolides. That is how macrolides inhibit bacterial protein synthesis. Let us move on to the spectrum or susceptible organisms. So here, taking erythromycin as the model drug for the whole group, we see that macrolides are narrow spectrum antibiotics. This means that they are only active against most gram-positive bacteria and only a few gram-negative bacteria. Let us look at the resistance against erythromycin or macrolides. First mechanism is efflux pumps. Efflux pumps are present on the cell membrane of the bacterial cell, and with the help of these pumps, the bacteria sends out the drug which renders them ineffective. The second mechanism is present in certain resistant bacteria that come under Enterobacteriaceae. This is because they have an enzyme known as erythromycin esterase enzyme. This enzyme degrades erythromycin and thus renders it ineffective. The third mechanism is alteration in ribosomal binding site by a plasmid mediated enzyme. The fourth mechanism is chromosomal mutation in 50S ribosome. Now, if an organism is resistant to erythromycin, it will also show cross resistance to other macrolides, which means that if an organism is resistant to erythromycin, it will also be resistant to all the other macrolides. It also shows partial cross resistance with chloramphenicol and clindamycin, which is a lincosamide. Coming on to the pharmacokinetics of macrolides. Erythromycin is acid labile in nature, which means that it gets degraded in the presence of acid. So, if we give this tablet without any coating, it will get degraded in the acidic environment of the stomach and its absorption will become difficult, which is why it is given as an enteric coated tablet. Macrolides are incompletely absorbed, that is, only 30 to 40% of them is absorbed. Let us look at the distribution. Macrolides are widely distributed in areas like cells and abscesses. They can cross serous membranes and even the placenta, which is why macrolides are contraindicated in pregnancy. But macrolides cannot cross the blood-brain barrier, which is why their CSF concentration will be low. Therapeutic concentration of macrolides is seen in prostate. They are 70 to 80% plasma protein bound. Macrolides are metabolized mainly in the liver and they are excreted primarily through bile, and a little bit is also excreted through the kidney. Before moving on to the uses and adverse effects, let us look at the classification of macrolides. First generation macrolides include erythromycin. Second generation macrolides include clarithromycin, azithromycin and roxithromycin. They can be remembered by the acronym CAR. Third generation macrolides include telithromycin. Now, let us move on to the uses. Here I split the uses into two parts because all these conditions, macrolides function as the drug of choice. So, even if you don't remember all these uses, it is better that you remember only these uses carefully. The acronym here is CLAP. C stands for cancroid and Corynebacterium diphtheriae, that is, macrolides are effective against these organisms. L stands for Legionella, and A stands for atypical pneumonia. P stands for pertussis. Let us look at a few more uses now of erythromycin. We have streptococcal pharyngitis, syphilis, leptospirosis, diphtheria, as they were the first choice drugs for against Corynebacterium diphtheriae. We have tetanus. Also, erythromycin is the first choice of drug or the drug of choice, like we just saw, for atypical pneumonia, pertussis, and cancroid. It is the second choice of drug for Legionnaires pneumonia, chlamydia, trachomatis, and UTI. This is a broad spectrum use, and this is more specific for erythromycin, which is why you might think that here we've written that they are the drugs of choice, but here I've said that they are second choice of drug. So these uses are for the whole class in general, and these are more specific for erythromycin. Lastly, let us look at the adverse effects of macrolides. Here again we have a very easy to remember mnemonic, which is macro. M stands for motilin receptor in GIT, which gets stimulated by the effect of macrolides. Now, if the motilin receptors are stimulated in the GIT, they will produce more contractions, which will increase the motility of the upper GIT and cause diarrhea. A stands for allergy. They are responsible for causing hypersensitivity reactions, which will show symptoms like rashes, eosinophilia, and fever. C stands for cholestatic jaundice, because they were metabolized in liver, as we saw earlier. This specifically is caused by the preparation of erythromycin in erythroestrolate salts. RO together stand for reversible ototoxicity. I hope you gained something out of this video. Thank you so much for watching.